limiting factor to all side planks is anterior shoulder pain. How many times have you coached your patient through a side plank and then they say, A, their shoulder hurts, or B, they felt their shoulder more than their abs? Why does this happen and what can we do about it? Well, if you've watched any of my previous side plank videos, you know that I like to give patients a very specific checklist to follow. The goal of the checklist is that it puts them in an optimal position so that when they move, they can actually work what they're trying to work. And in this case of a side plank, we're trying to work the obliques. Now, the first two parts of the checklist are really what I want to touch upon here and really bring that to your awareness. Because anytime that someone's going through a side plank, we often just tell them to go in this position and to raise their hips. And there's no emphasis on getting in a good position. So when we do that, what typically happens is the shoulder is too close to the ear and we're rolled forward, exposing this anterior shoulder or the humeral head, and then we just push up through that. When I put it like that, it should be obvious that this is the main muscle that's going to start to work. The problem is it doesn't have the tolerance and it's not in a good position to really have strength. So how do we fix shoulder pain when someone's side planking? Two things we need to think about when it comes to the starting position. First, put your patient in a really bad position. It's really easy to learn and get the opposite when they're really driven into the bad. So shoulder close to ear, step number one, push the floor away so that the shoulder goes as far away from the ear as possible. Step number two, draw back, AKA scapular retraction. Step number one, getting out of the neck. Step number two, getting out of that anterior shoulder. The goal of setting up like this is loading the shoulder blade, getting these stronger muscles that have leverage and have the tolerance to work when we're in our side plank is how we start to remove this anterior shoulder pain. Now, once you have that and once you're up, the third thing that I really want you to become aware of is reminding your patients that they need to continue to push away. It's really common that when we're in a side plank and even a lot of other exercises, when we're in it, patients just hold it, they're thinking of other things, and they start to fall and slip out of their form. So in this position up top, what they're gonna do is if they're not consciously thinking about it, they're gonna start to drop through that shoulder, and now we've just lost everything that we've created. So we have to really cue the patient that when they're up there, they need to continue to push the floor away with the elbow. This is going to keep them away from their ear, and it's going to keep them in that shoulder blade retraction position. So once they're up, we're maintaining that position, and that's really another key point to making sure that we don't get into this anterior shoulder pain. So that's how we can start to get rid of shoulder pain and start to really maximize our efforts with the side plank and feel the obliques. I'd encourage you to check out the full checklist in my previous videos. I will link it after this video so you can go through that, but really increase your patient's awareness of getting in a good position, making sure they feel it where they're supposed to feel it. That means not feeling the anterior shoulder and feeling the abs. And as they're going through it, they're continuing to remind themselves of these things so that way they can continue to work their abs throughout the duration of the side plank.